ஆரம்பிக்கலாம்.
Hello everyone. This video is done to educate everyone about something called as laryngopharyngeal reflux. From the name itself you can understand that this is something to do with the stomach enzymes coming into the throat. The throat doesn't like acid, so what happens? It produces more mucus. So the lining of the throat is filled with mucus. Now this is the reason for many vague symptoms that people come to us saying they have throat clearing. They constantly keep clearing their throat like this and they have a feeling of mucus in the throat, phlegm in the throat. Some people say they have a feeling of a lump in the throat. They say, doctor, something is stuck in my throat. I think there is something. Please remove it. And some people, they have sore throats that don't respond to medicines. Some people have hoarseness of voice. So these are the category of people who have laryngopharyngeal reflux. And the problem with diagnosing this condition is most of them, they do not have the heartburn, that is the burning sensation that comes here when most people have gastric acidity. This is not seen in most patients. Around 65% of the people don't have it. So that's the problem. Now this condition also can be confused with sinus allergies, and people sometimes think that they have some kind of cancer in the throat. So this is not true. It should not be thought about this way. So what are the various things that one needs to adopt to prevent this problem? So there are 3 tiers of management. The first most important thing is the diet. So this requires a change in diet. What are the things that you need to avoid? Caffeine is definitely one thing. Alcohol, tea, coffee. So these are the things one needs to skip. Also, oily, spicy diet and acidic citrus fruits. So these are the ones that need to be eliminated. The next important thing is behavioral changes. What are the lifestyle changes that are required? So those who have a tendency for this reflux, please have your meals at least 2 hours before bedtime. Another idea is to have smaller quantities of meals and eat regularly. Also drink lots of water in between. The other important thing is when you sleep, it is advisable to have the head end of the bed like this. You can put a wooden block or something which will be of 4 inches height, and you can keep the head end propped up like this. So this is another important thing which you need to adopt. Another thing is do not wear tight clothing that increases the pressure over this area. So when this area gets compressed, more acid can enter into your throat. So avoid exercise, any kind of maneuver that increases pressure in this area, like bending down. Avoid doing all this after a heavy meal or after any meals for that matter. The third tier of management, like once these symptoms don't resolve, you have to go for medical treatment. And medical treatment, it will take a minimum of 4 to 6 weeks for the drugs to take effect. And this is a little more difficult than heartburn. It will take more time for the symptoms to subside. So I've given a little bit of information on this, but this kind of advice is no substitute for consultation. So if you have any of these symptoms, this particular reflux should be kept in your mind and approach your doctor to look for the symptoms. Thank you.